wish surgeons would stop fixing broken hips on old people. I said what I said. Here's why I said it. An elderly woman with dementia is on hospice at an assisted living facility. She fell and 911 gets called. They send her to the hospital and the doctor says, well, her hip's broken. We have to do surgery. Why does he say that? She's on hospice because he's a surgeon and that's what he knows to do. So he talks the family into doing the surgery. It goes well, but the recovery isn't going so great. She's having a lot of pain and the doctor puts her on morphine. She's not used to getting opioids, so the side effect of sedation kicks in. Since she's sleeping all the time, now she's not eating. And with decreased nutrition, she's starting to get weak. She can't fight infection and she can't get out of bed. Pretty soon, she develops pneumonia from being sedentary, and shortly afterwards, she dies. This happens fairly often, even to people who aren't on hospice, and it doesn't need to be this way. If a doctor says there's no other options, that's a red flag. There is always another option, hospice. You can choose to opt out of the surgery and go on hospice. And even though either way you're likely going to end up on opioids for pain, the pain will be much less with a broken hip than a broken hip with an infected surgical incision. Death will still be the outcome, but the suffering is going to be much less with hospice.